My name is Gillian Anderson. I'm the chair of the Sociology department and also a professor in that department.
I'm Sylvie. I'm a sociology professor, but currently working with the Center for Innovation and Excellence in Learning.
Our project looks specifically at women and mothers' unpaid caring labor and paid caring labor in a variety of types of employment, and how those two types of caring work have shifted or changed alongside the emergence of both COVID, the first wave, and now as we enter into and continue through the second wave.
We do have some preliminary research done. We got some data from Statistics Canada, some labor force survey data that we looked at. And what we did is we looked at employment numbers for mothers on the island. So it's the economic region of Vancouver Island and the coast. So we looked specifically at the caring professions, so health, education, retail, and the service industries. These are female-dominated industries, and we looked at how they've been impacted by the shutdown and the call to stay home. We found what we thought we would find, that women, mothers, continued working throughout the pandemic. So a lot of people lost their jobs, but in these female-dominated industries like education and health, it's a lot more obvious. They continued working, and we knew that. Now we have the numbers to support it.
Teachers, created virtual classrooms and kept teaching. Nurses kept nursing, both of which continue to be gendered occupations in our region, particularly healthcare. If we look at the numbers, I think it was somewhere around 10,000 workers in healthcare were men, and about 40,000 were women. So we're looking at a hugely gendered sector.
And it confirmed a result that people have seen before across the world when there's an epidemic or some kind of outbreak, that women are affected sooner than men, and it takes them a lot longer to climb their way back out of the economic hardships.
So we have the numbers of the paid kind of caring labor, but what we're hoping to do with the qualitative survey data is to look into unpaid caring labor, how it is mothers' unpaid caring work, whether it's like the physical labor, the mental labor, the socio-emotional work that goes into parenting and mothering that primary caregivers engage in, and how that's been impacted by COVID. Some of what we've also been wondering and asked in our research are, what are some of the perhaps unforeseen positives that may have emerged as well? It may be the case that some people have had an opportunity to get reacquainted with their family and or spend more time with their family than their previous work lives that take them out of the home for a considerable period of time have allowed in the past. So just trying to get a better understanding of what that map of those redrawn boundaries of work and family have meant for mothers of children of a variety of ages.
We have a lot of responses. I think over 700 completed survey responses, which was way more than we had anticipated. So we're happy for that, but we got a lot of data to comb through. We got to put it all into Excel, and we got to extrapolate it, and then we got to look at the quantitative and qualitative answers of it and put it in SPSS. So it's a lot of work to do. But once we do the analysis and we come up with some themes and understand a bit more how COVID affected unpaid labor, we could hopefully add to the discussion of the development of social supports to help mothers cope with caring labor in Canada, and maybe help with the information that's coming and with the pandemic, and trying to better understand how we can help mothers with their response to the increased duties of what COVID brings to families.
Some of what motivates social science and social science researchers is related to some of what may be captured under that kind of phrase, the personal is political. So some of what's going on in our everyday lives prompts us to consider or want to research how it is those lived experiences shape not only our lives, but the lives of people around us. And so some of it is what was motivated by what we saw and heard from our family members and or our friends, and in some instances our students. Some of our students were also parents, and mothering in particular. So caregiving, broadly defined, was something that we saw as being stretched and or changed and altered in light of not just the arrival of the pandemic here in BC, but how it was that as part of the public discourse, the call to stay at home was really impacting families in general and women in particular, and women as mothers.